At 68, Mr. Ahmed thought his late-night habit was harmless, private, natural, even healthy. But when he walked into my clinic with chronic pelvic pain, weak urine flow, and exhaustion he couldn't explain, he asked me one question that stopped me cold. "Doctor, could this be from something I've been doing for years? If you're over 60, what I'm about to share could quietly change your health, starting tonight." As men cross the age of 60, their bodies undergo quiet but significant changes that are easy to underestimate. One of the most misunderstood changes involves recovery. In younger years, the male body is remarkably resilient. Hormones like testosterone are higher, blood vessels are more elastic, nerves recover quickly, and muscles, including those in the pelvic floor, bounce back with little effort. This creates the illusion that sexual activity, including masturbation, has no lasting cost. After 60, however, that illusion slowly fades, and overstimulation without proper recovery can begin to take a real toll. The pelvic floor muscles play a central role in erections, ejaculation, and bladder control. During masturbation and orgasm, these muscles contract repeatedly and intensely. When a younger man overstimulates himself, those muscles usually recover within hours. In older men, recovery can take days. Repeated stimulation without rest keeps these muscles in a constant state of tension, similar to working the same muscle group at the gym every day without rest. Over time, this leads to muscle fatigue, reduced control, and even chronic pelvic discomfort. Nerve sensitivity also changes with age. Nerves that transmit pleasure signals become less efficient, and excessive stimulation can desensitize them further. This is why some older men notice that orgasms feel weaker or less satisfying than they once did. The problem is often not a lack of desire or attraction, but overstimulation that overwhelms aging nerves. Instead of enhancing pleasure, frequent intense stimulation dulls it, creating a frustrating cycle where men stimulate more aggressively to chase sensations that are becoming harder to reach. Blood flow is another critical factor. Erections rely on healthy circulation, but after 60, blood vessels naturally stiffen and narrow. Overstimulation increases demand on this already compromised system. Without adequate recovery, blood vessels and erectile tissue do not have time to fully replenish oxygen and nutrients. Over time, this can worsen erectile quality, leading to erections that are weaker, shorter lasting, or inconsistent. Many men mistakenly believe this is inevitable aging, when in reality it is often aggravated by poor sexual habits. The prostate can also be affected. While regular ejaculation may support prostate health, excessive ejaculation without rest can irritate the prostate gland. This irritation may show up as a dull ache in the pelvis, discomfort after ejaculation, frequent urination, or a feeling of pressure. Because these symptoms develop gradually, men rarely connect them to overstimulation. Instead, they assume it is just another inconvenience of getting older, allowing the problem to persist unchecked. Mental and physical fatigue are closely linked in this process. Sexual activity triggers hormonal shifts, including the release of prolactin, which induces relaxation and sleepiness. When masturbation becomes too frequent, especially late at night, it can disrupt sleep patterns, lower energy levels, and reduce motivation for exercise and social engagement. Over time, this fatigue feeds into poorer circulation, lower testosterone, and declining sexual function, creating a loop that quietly erodes overall health. The most important thing to understand is that recovery is not about abstinence or fear. It is about respect for the body's changing needs. Just as older joints need more rest after physical exertion, sexual systems require time to reset. Allowing recovery helps muscles relax, nerves regain sensitivity, and blood flow normalize. This leads to stronger erections, more satisfying orgasms, and fewer prostate-related symptoms. In many cases, simply reducing frequency and intensity produces noticeable improvements within weeks. A short example illustrates this clearly. A 67-year-old retired shop owner noticed that his orgasms felt weak and that he often had pelvic discomfort afterward. Believing the problem was aging, he increased stimulation, hoping to wake things up. Instead, symptoms worsened. After learning about recovery, he reduced frequency, avoided rushed or aggressive stimulation, and focused on relaxation and hydration. Within a month, discomfort decreased, orgasms felt fuller, and his confidence returned, not because his body became younger, but because he allowed it to recover. Overstimulation without proper recovery does not damage men overnight. It works slowly, quietly, and silently, which is why so many older men overlook it. Understanding this change is not about giving something up, it is about adapting wisely. Aging does not mean the end of sexual health, it means learning how to protect it. As men move past the age of 60, life often becomes quieter in ways that are rarely discussed. Retirement changes daily structure, children build their own lives, friends drift away, and physical energy is not what it once was. In this quieter space, stress does not disappear, it simply changes form. Anxiety may come from health worries, financial concerns, or the fear of becoming less relevant. Loneliness may arrive slowly, disguised as boredom or restlessness. In this stage of life, many men unconsciously turn to masturbation as an easy, private way to cope with these emotions, believing it brings relief. While occasional sexual release is normal and healthy, using it as the primary escape from emotional discomfort can quietly create deeper problems. When masturbation is used repeatedly to numb stress or fill emotional gaps, the brain begins to associate sexual stimulation with emotional relief rather than physical pleasure. This shifts the role of masturbation from a healthy bodily function to a coping mechanism. Over time, the brain relies on dopamine spikes from sexual stimulation to temporarily soothe anxiety or loneliness. After 60, the brain's reward system becomes more sensitive to this pattern, making emotional dependency more likely. The relief becomes shorter, while the urge to repeat the behavior grows stronger, not because of desire, but because the mind is seeking comfort. This habit can disrupt hormonal balance in subtle ways. Sexual stimulation affects hormones such as dopamine, oxytocin, and prolactin. When masturbation becomes frequent and emotionally driven, prolactin levels may rise more often, contributing to fatigue, low motivation, and emotional flatness. Testosterone, which is already declining with age, can feel even lower due to poor sleep, reduced physical activity, and emotional withdrawal that often accompany this cycle. The result is a paradox. The very behavior meant to provide comfort slowly weakens sexual confidence and overall vitality. Emotional isolation is another hidden consequence. When masturbation replaces social interaction, conversation, or meaningful engagement, it reduces motivation to seek real connection. This does not happen consciously. A man may tell himself he is simply tired or prefers solitude, while the deeper truth is that his emotional needs are being temporarily muted rather than fulfilled. Over time, this can lead to increased irritability, sadness, and a sense of emptiness that masturbation can no longer cover. Sexual desire may decline, erections may feel weaker, and satisfaction decreases, not because of aging alone, but because emotional health and sexual health are deeply intertwined. Stress-related masturbation also affects sexual performance. When sexual release is driven by anxiety, the body remains in a tense state. Instead of relaxation, the nervous system stays alert, making it harder to achieve strong erections or satisfying orgasms. This can create performance concerns, which add more stress, reinforcing the cycle. Many older men mistakenly believe this decline is inevitable or physical, never realizing that emotional habits are playing a major role. Sleep disruption is another quiet factor. Using masturbation late at night as a way to unwind may seem harmless, but frequent nighttime stimulation can interfere with natural sleep rhythms. Poor sleep worsens anxiety, lowers testosterone, and reduces emotional resilience. Over weeks and months, this contributes to chronic fatigue and low mood, increasing reliance on the very habit that is causing the problem. The issue is not masturbation itself, but intention and balance. Sexual release should be a response to desire, relaxation, and self-awareness, not a reflexive answer to stress or loneliness. Healthy alternatives such as light exercise, daily walks, social interaction, hobbies, or simple routines can meet emotional needs in ways that strengthen both mind and body. When emotional fulfillment improves, sexual function often improves naturally. A short example makes this clear. A 65-year-old retired office worker began masturbating daily after retirement, mostly in the evenings when he felt bored and restless. At first, it helped him sleep, but over time he noticed lower energy, weaker erections, and a growing sense of isolation. After recognizing the pattern, he replaced some evenings with walks, phone calls with friends, and regular sleep times. Masturbation became occasional rather than automatic. Within weeks, his mood lifted, sleep improved, and sexual response felt more natural and satisfying. Not because he did more, but because he relied less on it emotionally. Using masturbation as an emotional escape does not harm men suddenly. It works slowly, quietly, and invisibly. Understanding this connection allows older men to protect not just sexual health, but emotional well-being and dignity. Aging does not remove the need for connection. It makes it more important than ever. As men grow older, one of the most dangerous habits they develop is not physical, it is mental. Many begin to normalize discomfort. Small aches, reduced sensation, weaker response, or mild pain are often brushed off with a simple thought, "This is just old age." While aging does bring changes, pain, numbness, and noticeable loss of sexual sensation are not automatic or harmless consequences of getting older. They are signals. And when these signals are ignored, especially in relation to masturbation or sexual activity, the underlying problem can quietly worsen. After 60, the body becomes less forgiving when something is wrong. Nerves regenerate more slowly, blood vessels are less elastic, and inflammation takes longer to resolve. If a man experiences pain during or after masturbation, reduced sensation in the penis, delayed or weak ejaculation, or a lingering ache in the pelvis, these are not random events. They often indicate nerve compression, reduced blood flow, pelvic floor dysfunction, or early prostate irritation. When stimulation continues without addressing these signs, the affected tissues remain under stress, allowing damage to accumulate rather than heal. One common issue is nerve sensitivity. Aging nerves are more vulnerable to pressure and repetitive stimulation. Persistent numbness or tingling can signal that nerves are being overstimulated or compressed, sometimes by tense pelvic muscles or poor circulation. Ignoring this and continuing the same habits can lead to long-term desensitization, where pleasure decreases significantly and may not fully return. Many men then mistakenly increase intensity or frequency, believing they need more stimulation, which only worsens the problem. Circulation problems also play a major role. Erections depend on healthy blood flow, but conditions such as high blood pressure, diabetes, and cholesterol issues become more common with age. Pain, weak erections, or a reduced sense of fullness during climax can be early warnings that blood supply to erectile tissue is compromised. Continuing to masturbate aggressively without medical attention can strain these tissues further, increasing the risk of erectile dysfunction. What could have been improved with early lifestyle changes or treatment may become much harder to reverse later. The prostate is another silent victim of ignored warning signs. Discomfort after ejaculation, pressure in the lower abdomen, or frequent urination following sexual activity can indicate prostate inflammation. While moderate ejaculation can be beneficial, forcing the body through pain or irritation repeatedly keeps the prostate in a state of chronic stress. Over time, this may worsen urinary symptoms, sexual discomfort, and overall pelvic health. Many men endure this quietly for years, assuming it is inevitable, when early evaluation could have prevented progression. Psychologically, ignoring these signs can create fear and frustration. A man may notice that sensations are fading or that orgasm feels incomplete, but instead of seeking help, he internalizes shame or anxiety. This emotional stress tightens muscles, worsens circulation, and further reduces sexual response. The result is a cycle where physical symptoms and emotional distress reinforce each other, accelerating decline rather than slowing it. The most important truth is that the body communicates before it fails. Pain is not punishment. Reduced sensation is not weakness. These are protective warnings asking for attention, rest, or medical guidance. Addressing them early often leads to significant improvement. Simple changes such as reducing stimulation intensity, allowing more recovery time, improving hydration and movement, managing blood sugar, or consulting a urologist can restore comfort and function. Waiting too long, however, may turn reversible issues into permanent ones. A short example illustrates this clearly. A 70-year-old man noticed mild burning and reduced sensation after masturbation but ignored it for nearly a year, believing it was just aging. Over time, the discomfort increased and erections weakened. When he finally sought medical advice, tests revealed prostate inflammation and poor pelvic circulation. With treatment, lifestyle changes, and gentler habits, his pain improved. but full sensitivity did not completely return. His doctor explained that earlier attention could have prevented much of the damage. Ignoring warning signs does not protect dignity, it risks it. Aging well means responding wisely to the body's messages, not dismissing them. When older men listen early, they preserve not only sexual health, but comfort, confidence, and quality of life. As men age, their bodies change in ways that are subtle but deeply important, especially when it comes to skin, blood vessels, and nerves. After the age of 60, the skin becomes thinner, less elastic, and more prone to irritation. Blood vessels supplying the penis and surrounding tissues also become more fragile, while nerve endings lose some of their resilience. These changes do not mean sexual activity must stop, but they do mean that habits formed decades earlier may no longer be safe. One of the most overlooked problems in older men is continuing rough masturbation techniques or neglecting proper lubrication, which can silently cause long-term damage. In younger years, the skin and underlying tissues can tolerate friction, pressure, and prolonged stimulation with little consequence. After 60, repeated friction without lubrication can create microscopic tears in the skin. These micro-injuries are often painless at first, which is why they go unnoticed. Over time, however, they lead to chronic irritation, inflammation, and increase. ED sensitivity, or paradoxically, numbness. The body responds to repeated injury by thickening or scarring tissue, which reduces sensitivity and interferes with natural sexual response. Poor lubrication worsens this problem significantly. Natural lubrication and skin oils decrease with age, and conditions such as diabetes, dehydration, or certain medications can make dryness more severe. Without lubrication, friction increases dramatically. This not only irritates the skin, but also stresses blood vessels and nerves beneath the surface. Repeated dry stimulation can impair circulation to erectile tissue, contributing to weaker erections and slower arousal. Many men blame aging alone, never realizing that the issue is mechanical rather than inevitable. Aggressive pressure is another common issue. Some men squeeze, grip tightly, or apply intense pressure in an effort to maintain sensation that has begun to fade. Unfortunately, this can compress delicate nerves and blood vessels. Chronic compression reduces oxygen delivery to tissues and interferes with nerve signaling. Over time, this can cause reduced sensitivity, delayed ejaculation, or difficulty achieving orgasm. In severe cases, men may experience lingering soreness or a dull ache that lasts long after stimulation ends. Prolonged sessions compound these effects. Aging tissues need more time to recover, just like aging joints or muscles. Extended stimulation keeps tissues engorged and under pressure for too long, increasing inflammation and slowing healing. When this becomes habitual, irritation never fully resolves. The result can be chronic redness, burning sensations, or a persistent feeling of discomfort that affects daily life, not just sexual moments. There is also a psychological impact. When pleasure decreases due to physical irritation or numbness, frustration sets in. Men may push harder or longer to achieve satisfaction, unknowingly accelerating the damage. This creates a cycle where declining sensitivity leads to more aggressive habits, which further reduces sensitivity. Over time, sexual confidence erodes, and anxiety replaces enjoyment. What makes this issue particularly harmful is how disconnected it feels from cause and effect. A man may notice reduced pleasure, weaker erections, or persistent irritation, but never link it back to technique or lubrication. Instead, he may assume something is wrong with him or that his sexual life is simply ending. In reality, many of these changes are preventable or reversible when habits are adjusted early. Healthier approaches involve gentler techniques, adequate lubrication, and shorter, more relaxed sessions. Lubrication reduces friction, protects skin integrity, and improves comfort and sensation. Gentler pressure allows nerves and blood vessels to function properly rather than being compressed. Allowing sufficient recovery time helps tissues heal and reduces inflammation. These changes support not only sexual pleasure but also overall penile and pelvic health. A short example illustrates this clearly. A 66-year-old man noticed increasing irritation and reduced sensation during masturbation. To compensate, he tightened his grip and prolonged sessions, believing he needed more stimulation. Over months, discomfort became constant and erections weakened. After learning about aging skin and lubrication, he switched to gentler techniques, used proper lubrication, and reduced session length. Within weeks, irritation subsided and sensation partially returned. His experience showed that the problem was not aging itself, but habits that no longer matched his body's needs. Rough techniques and poor lubrication do not cause dramatic injury overnight. They work slowly, quietly, and cumulatively. Understanding this allows older men to protect sensitivity, comfort, and sexual confidence well into later life. Aging requires adaptation, not abandonment, and small changes can make a profound difference. As men grow older, especially after 60, daily routines and priorities often change in quiet but powerful ways. Retirement reduces structure, physical activity naturally declines, social circles may shrink, and sleep patterns can become irregular. In this new phase of life, some men unconsciously begin to rely on sexual release, particularly masturbation, as a substitute for habits that once kept their bodies and minds balanced. While masturbation itself is not harmful, problems arise when it slowly replaces physical movement, emotional connection, meaningful engagement, and proper rest. When sexual release becomes the main source of comfort, relaxation, or satisfaction, overall health, especially sexual and prostate health, can decline rather than improve. The male body depends heavily on circulation, hormones, and nervous system balance. Physical activity such as walking, stretching, or light strength training keeps blood vessels flexible and supports healthy blood flow to the pelvic region. When activity decreases, circulation worsens, and erectile tissue receives less oxygen and fewer nutrients. If masturbation becomes the primary or only outlet while physical movement is neglected, erections may weaken over time, not because of age alone, but because the vascular system is no longer being supported. Sexual release cannot replace the benefits of movement. It relies on circulation. It does not create it. Hormones are affected in a similar way. Testosterone naturally declines with age, but lifestyle choices strongly influence how steep that decline becomes. Regular exercise, sunlight exposure, quality sleep, and emotional engagement help stabilize hormone levels. When these are replaced by frequent sexual release, without balance, testosterone can drop further. Poor sleep, often worsened by late-night masturbation habits, disrupts hormonal cycles, leading to fatigue, low motivation, reduced libido, and weaker sexual response. Men may then turn even more to masturbation, believing it will restore desire, when in reality, it deepens the imbalance. Emotional health is another critical factor. Humans need connection, purpose, and mental stimulation at every age. After 60, loneliness can creep in unnoticed. Masturbation can temporarily numb feelings of emptiness or boredom, but it does not fulfill emotional needs. When it replaces conversation, companionship, hobbies, or social interaction, emotional isolation increases. This isolation raises stress